Now, there are people around that say there is no HIV virus. We know there is one. We are studying this in our research institute. We know exactly there is one. But what we know also is that this virus is not the deadly virus that causes AIDS, the deadly AIDS condition. Unless there is a co-factor. There are co-variables in the game, meaning maybe a cytomegalovirus virus or another virus. We don't know that. No one knows this. But the statistics are very clear. Putting that aside for a moment, what the pharmaceutical industry says, we are not interested in what really causes that. We just want this equation. Because then, if we have in the perception of the people, of the doctors and the common man, this equation, we have the same threat potential we have with cancer, like with cancer. You are HIV infected, you're going to die. If you're going to die, you will follow what I give you. You will take my ARVs. And from then on, this human body is my marketplace. If you take ARVs, you have the same line of symptoms. You develop all kinds of infections that you've never seen in your body. HIV positive people on ARV drugs have a 4 to 6 times higher chance of dying from AIDS than if you do not take those drugs. But then, what about Bono? What about Brad Pitt? What about all those singers and musicians and the politicians who are Tony, his Marshall Plan for Africa? They're taking your taxpayer money and telling you, I'm Tony. I need your money to help the poor in Africa. What he's really doing is, he's putting the money down the throat of GlaxoSmithKline, who are the largest exporters of these ARVs to Africa, for drugs that do not help, but cause death in genocidal proportions, financed with your taxpayer money. I'm not singling out Tony. Angela across the channel does the same. Boehringer Ingelheim produces nevirapine. Same thing. The politicians of the largest exporting nations of pharmaceutical drugs, they are running around like Mother Teresa, pretending to help the poor, while in reality promoting toxic, deadly ARV business and financing the pharmaceutical business with disease with your taxpayer money. That's the name of the game. This is what we did. We are donating our vitamins to the poor communities around Cape Town and in other areas too. These are the first 15 patients we have helped, and it was their idea to hold this press conference because they wanted to speak to the world and say, see, we are leading a normal life again. We studied the effect of the micronutrients in form of a questionnaire that was filled out by the patients and the nurses that evaluated the different symptoms of these patients. If they were very sick, they were seen by a community doctor. So this was the way we could help them. The whole program was conducted by a community organization, like corresponding to the GLC, for example, in a township, on a much smaller scale, of course. We would donate the vitamins to them. They would give it out to the needy. They would be responsible for the assessment of the improvements. But what we found was most significant. AIDS, according to the WHO, is not defined as HIV infection. AIDS is defined as the occurrence of key symptoms. And one of them is the continuous reoccurrence of fever and chills. So we were interested to assess the reoccurrence of fever and chills with micronutrients. And as you can see, there was after 4 weeks a 52% decrease, and after 8 weeks it stayed constant. 52% decrease, an effect that was never seen with an ARV drug. The second symptom, according to the WHO, that defines AIDS is constant diarrhea. Now, diarrhea decreased by 50% and 51% after 4 and 8 weeks, respectively. The third symptom is persistent cough. If you have real AIDS, not HIV infection, if you have real AIDS, you cough consistently. Because your lung infections. Now, there was a 33% decrease and a 39% decrease after 4 and 8 weeks, respectively, in that symptom. The last AIDS-defining symptoms is TB, tuberculosis-related symptoms. They decreased 40% and 61% with micronutrients only. None of these patients was on ARV drugs during that time. Now, while all this may be statistics, this is something you can see. AIDS is causing ulcers everywhere in the body. Most prominently, of course, are those seen outside on the skin. And then these wounds are being infected, super infected with bacteria in this case. Now, this is the same color region of the same patient after 4 weeks of micronutrients. And this is the young lady that is still doing wonderful. She calls me, "You're my dad." As I said, I can only touch a few things today, but it gives you an impression on what's going on in the field of science. We need to briefly touch on the field of politics. No one in South Africa can afford ARV drugs. So the only way for Glaxo to sell its drugs, or for that matter for other pharmaceutical companies in this business, is to organize pressure groups in South Africa that go through the streets in SR formations and demand the government free ARVs for all. You will not believe it, but that's happening as we sit here. One of these groups is called Treatment Action Campaign. Like the brown shirts in 1933, they have a uniform. And in this case, this is a white t-shirt that says HIV positive. Hardly any one of this is HIV positive. The way they organize their demonstrations is they take a bus, sponsored from abroad, of course. They drive through the poorest of the poor townships. They pick up the young kids that are unemployed, have nothing to eat. They give them a sandwich, a Coke, and a t-shirt saying HIV positive. And for that, they put them in the bus, they bring them to Cape Town or another major city, put them a placard in the hand, and then run against your own government. Not to forget, at the next corner is the television crew from the BBC and from CNN, reporting that the people of South Africa are rallying against their own government to demand, finally, ARV drugs. Talking about creative marketing, there you have it. These guys are so bold because of all the support they get. not from the people, but financial support from abroad.